joins gathered students, lawyers, and policymakers from across Africa to discuss how legislation can strengthen healthcare systems and protect citizens' rights. Speaking on the theme Legislating for Health Justice, Advancing Universal Health Coverage in a Pan-African Context, Dr. Kingsley Agyemang urged Parliament to move beyond rhetoric and enact reforms that make healthcare equitable, accessible, and universal.
That is the true spirit of universal health coverage. To legislate for health justice is therefore to legislate for human dignity. It is to recognize that behind every clause debated and every budget approved stands a life that depends on the choice of Parliament. We have to put a human face to health justice. At the heart of every policy, every statute, and every budget line lies a human story. Health justice is not about statistics or hospital infrastructure alone. It is about the lives and dreams of people whose names may never appear in our reports, but whose struggles define the moral duty of leadership. A few years ago, I met a young mother in the eastern region of Ghana. She had walked more than 6 kilometers to reach the health center, only to find that the nurse on duty had no delivery kits. She wrapped her newborn baby in a home scarf, smiled, and whispered that she was grateful her child had survived. That single encounter taught me that legislation must not only allocate funds, it must protect dignity.
Dr. Kingsley Agyemang also called for a continental legal framework to harmonize national health laws and align with the African Union's Agenda 2063 and Africa Health Strategy.
Health justice in Africa cannot be pursued in isolation. Disease, like poverty, knows no borders. A child cough in Lagos, a cholera outbreak in Harare, or a malaria set in Isigani can all ripple through the continent if we do not stand together. The pursuit of universal health coverage, therefore, demands that African nations see themselves not as competitors, but as collaborators in a shared human project. Our strength lies in collective vision. The African Union's Agenda 2063 and the African Health Strategy reminds us that our future will be written not in the silence of national policies, but in the bridges of continental cooperation. When nations share data, align health standards, and build research capacity together, they create a shield that protects every African life.
Some participants in Addis Ababa welcomed his message, saying if African leaders adopt his recommendations, the continent could make real progress towards universal health coverage.
I think for the most part, when we talk about health equality, we focus on the health receivers, the patients who receive the health, but we forget that there are also providers who provide the health. So when Honorable was giving his speech, he mentioned that it's a shared responsibility, and so it has to be a very good balance between the providers and then the people who receive the help and governance in general, because then that ties into the legislation bit of everything.
For Dr. Kingsley Agyemang, health justice must be Africa's next major legislative priority. For JoyNews, Carlos Caloni, Addis Ababa.